Hello and welcome. As we continue our education on knee pain issues and problems and injuries, we look at the ligaments. The main ones being the inner or medial ligament here, the outer or lateral ligament, and then inside of our knee we have a cruciate ligament, which is two ligaments which cross across each other. You may have heard of an ACL ligament injury, which is very common in sports players, but we also have something called a PCL ligament as well, and that's less common but can be injured as well. These are the main ligaments that we talk about around the knee joint, and when they're injured you will know about it. Usually it happens from a sport, or it can happen from an impact or an activity that you were doing. Usually it will create some swelling quite immediately after the injury, and it will quite be difficult to put pressure and walk on that knee initially. Now, when it comes to ligament injuries, if it is through an impact, something we can't help, you had a tackle, a bad tackle, or you tripped and slipped and managed to twist the knee into a particular position, which has caused a ligament injury. We've got to understand the extent of the injury. So how bad is the tear? Is it from a grade 1 all the way to a grade 3, which would be a full rupture of the particular ligament? We've got to understand that first of all, and then that will decide on what kind of treatment options you have. The most common being a small grade 1, grade 2 tears of the ligaments, and this is definitely treatable through some hands-on therapy and also through some corrective exercises. Essentially, the ligament begins to heal by itself. If you give it time, it will heal. What we have to think about, however, even if it is an impact injury, is to think about the mechanics of the body after the injury. So as an example, tends to be an injury, let's say on the medial side of the knee, and if you end up having to hobble around a lot for a couple of weeks because of the injury, you will start to change your mechanics a little bit and maybe potentially get a little bit of back pain, maybe not really function on the knee very well, or in the foot and ankle very well. And usually I tend to see about 5 or 2-3 years later injuries happening elsewhere on the same side. So it's quite important to think about rehabilitation of a ligament injury, specifically in and around the knee. What I do want to share with you and talk about is actually the biomechanical side of ligament injuries that can occur as well. We do tend to see sports players that are sprinting to get a ball, or just playing an activity or a game, and as they're sprinting with no impact injury or no tackle, they do damage to their ligament, and that's usually because of some biomechanical problem that's occurring maybe at the foot and ankle or at the hip, and that's creating a lot of pressure building up around the inside or the outside of the knee, or even the ACL and PCL lying inside of the knee joint. So in terms of treatment options, we've got to understand the extent of the injury. Of course, if it is a full rupture of the ligament, which you will know about, and it will be very sore and wouldn't be able to really put any weight through that leg at all, you will need some surgical intervention to repair the tissue. However, commonly being smaller type of ligament injuries, we need to think about hands-on therapy, corrective exercise, rehabilitation, and long-term prevention. We're going to think about the mechanics of the foot, the hip, the lower back and the spine, and think about how we add those into functional movements to get you back to playing a sport or the activity and work that you are getting involved into. So hopefully that's helpful. Like I said in previous videos, we have a knee masterclass that is a link just below. Please do click, and you just have to put a few details in and you'll receive this masterclass, which will tell you a little bit more about the anatomy, the mechanics, how everything works, and it will give you much better understanding of thinking about your treatment options, thinking about how you go about catering for this particular type of injury and other types of knee injuries. As we've said before, we're happy to take a call. Please do give us a call if you have any questions, and we'll be happy to point you in the right direction. Even if you think you may need a consultation with an orthopedic surgeon or a surgeon of some kind, but you're not sure whether you need it, please do give us a call and we'll be able to chat through with you.